So if we take a closer look at these gram-negative versus gram-positive, okay, so the gram-negatives, remember, even though in this picture it looks purple, try to imagine it being pink, okay, because the gram-negatives were the ones that were susceptible to the alcohol and lost the crystal violet, okay. While the gram-positives were the ones that retained that crystal violet and remained purple at the end of the day. Now, if you notice, the gram-positives and the gram-negatives have very different cell membranes, the outer structure of the cell. And that's exactly what we're looking at here. So both of these bacteria, if we look at the innermost part of their membrane, they have a classic plasma membrane, right, made of double layer of phospholipids and some proteins, okay? Now, the gram-positive, however, has this thick cell wall made of what we call a peptidoglycan, right? It's just a substance that forms this very thick cell wall in the gram-positives, okay? The gram-negatives, they have a very thin layer of peptidoglycan, this very thin layer of substance making up the cell wall, and then they have an additional layer of membrane. Okay? Now, this difference, okay, is what creates this different susceptibility to the alcohol. When the alcohol is applied to these two membranes, in the gram-negative, the alcohol breaks down this outer membrane, okay? And what it does is it allows that crystal violet iodine dye to be let go. It allows that crystal violet iodine to escape. However, the alcohol can't penetrate this thick peptidoglycan wall in the gram-positive, so this cell retains the crystal violet iodine. Okay? So at the end of the stain, the gram-negatives appear pink, the gram-positives appear purple. Okay? Now, why do we care? Why is this important in terms of gram-negative and gram-positive? So most bacteria will differentiate between gram-negative and gram-positive. And in terms of treating human infectious diseases or understanding infectious diseases, gram-positive and gram-negative bacteria differ in some important ways. So if we look at the gram-positives, what we see is that there are far fewer pathogenic gram-positive bacteria. Okay? Most gram-positive bacteria are non-harmful, and there's really only a small group of gram-positive bacteria that are harmful. Okay? In addition, the gram-positives are more susceptible to an enzyme that we have in our body, particularly in saliva, called lysozyme. Lysozyme is an enzyme that breaks down that peptidoglycan wall and can destroy the gram-positive bacteria. Okay? So this lysozyme that we have in saliva, right, is effective or much more likely to kill gram-positive bacteria compared to gram-negatives. Additionally, most antibiotics will be able to attack and destroy gram-positive bacteria. So the gram-positives tend to be fewer of them are pathogenic. They are more susceptible to things like lysozyme and more susceptible to antibiotics. The gram-negatives, okay, in terms of clinical microbiology, they tend to be the bad guys. Gram-negatives, 90 to 95% of gram-negative bacteria are pathogenic. Okay? One of the reasons why gram-negatives are so disease-causing in humans is because in their outer membrane, they contain something called lipopolysaccharide. And you can see that right here, I'm pointing to it. Okay? It's this fat sugar complex that is attached to the outer membrane. It's lipopolysaccharide, LPS, also known as endotoxin. This substance, when it gets inside of our body, it activates a part of our immune system called the complement system. And the complement system triggers widespread inflammation, and it makes you feel very sick. Okay, so just to emphasize this, if I took LPS, endotoxin, without the organism at all, and I put it in your bloodstream, what you would see very quickly is the development of flu-like symptoms. Okay, so LPS, endotoxin, the outer shell of gram-negative bacteria, very strongly elicits a negative or toxic effect on our body. Okay, fever, chills, aches, everything that you associate with being sick. Gram-negative bacteria are also far more resistant to lysozyme. Okay? Lysozyme, which breaks down that peptidoglycan layer. The gram-negatives, their peptidoglycan, they don't have a whole lot of them, and that lysozyme really can't cross that outer membrane. And the same is true with many antibiotics, that gram-negatives tend to have more resistance from antibiotics, and I'm not talking about developed resistance, just there are fewer antibiotics effective against gram-negative bacteria. And part of that reason is because antibiotics are very water-soluble substances, and they tend to not be able to cross this outer membrane. Okay. So those gram-negatives, in terms of clinical microbiology, they tend to be the bad guys more often than the gram-positives. So here we see that infections can affect many parts of our body, and based on location of the infection, you see here in this slide a list of more common microorganisms, pathogenic microorganisms that can cause infection in different sites of the body. Okay. Now this is purely for your reference, but one implication of this is, and it happens very commonly, is that people often will have an infection, let's say an inner ear infection, and they don't finish the penicillin or the amoxicillin that they're prescribed, right? So they have leftover antibiotic that treated their ear infection, and then later on maybe they get a urinary tract infection, and they think, before they go to the doctor, or instead of going to the doctor, I'll just take this leftover antibiotic. And what's very important is that practice is extremely dangerous, because the microorganisms that tend to infect things like the head and the neck are very different from microorganisms that tend to infect the lower urinary tract or other parts of the body. Okay? So you'll find that drugs, different antibiotics used to treat different infections often differ greatly depending on where the infection is. Okay. So this process, this infectious process, it really describes the movement of an infection from one person to the next. Okay? And that's how infections spread. They're present in one person, and then it's transmitted to the next and transmitted to the next. Okay. Now, infectious diseases can be caused by a variety of microorganisms, as we said. Most common microorganism to cause disease are viruses. Okay. And the transmission of an infection is the requirements for an infection to be transmitted is often described as it being like a chain, where we have very specific steps that need to occur in order for an infection to move from one person to the next. So if we take a look at this analogy, the sort of chain of transmission of microorganisms, what we see is we start with a reservoir. Now, a reservoir is a organism or a place in which the microorganism prefers to live. Okay? Not where it can live, but where it prefers to live. Okay, so there are microorganisms that are very happy to live in humans. There are microorganisms that tend to live in animals, some in insects, and some even just in the soil. Okay, so an example of a microorganism that is very happy to live in an insect, because there's many, but of particular interest to us lately is the Zika virus, right? So one example, the Zika virus. It likes to live in a very particular type of mosquito, right? Now, the next chain is how this organism is going to exit the reservoir. Now, it can exit carrying that Zika virus example. It exits through the oral mucosa of the mosquito. Okay? So the mosquito has the Zika virus in its saliva when it bites the person. Okay? So now we're on to mode of transmission. So for Zika virus, the mode of transmission is an insect bite, right? Is the mosquito bite, which transmits the virus from the saliva, from the oral mucosa to the person. Other modes of transmission include things like nasal droplets, when you sneeze and the pathogen escapes through droplets that are aerosolized in the skin. Another is semen. The HIV virus is found in high amounts in semen, and it can travel that way. So it then has to enter the next individual in some sort of port, right? So some port of entry. And that port of entry for our Zika example is a skin puncture from the mosquito. Okay, the skin puncture inserts that virus into the bloodstream. It can also be, a port of entry can also be the nasal mucosa, right? Breathing in those droplets that somebody sneezed. The oral mucosa, those droplets getting in your mouth, or having a skin abrasion that allows the microorganism to directly enter. And then finally, one factor that affects this ultimate transmission is the susceptibility of the victim. So many microorganisms will be successful at transmission regardless of the susceptibility of the victim, but there are many factors that will enhance the likelihood of transmission. Things like having a victim that is malnourished, that is under-immunized, that is immune compromised. All of those things will greatly enhance the likelihood of transmission. Now, transmission of diseases, and we'll talk more about this when we talk about infection control precautions. Transmission is described in a couple of basic ways. There's what's called direct contact with body fluids, meaning you actually have to physically be in contact with it to be able to transmit the disease. There's transmission through droplets, meaning a person coughs or sneezes and the pathogen, that you have droplets that get aerosolized, right? And they contain pathogens, and then you can breathe that in and it can get transmitted that way. And then there's also airborne transmission, which is almost a extreme version of droplet. So with airborne transmission, those droplets that got aerosolized, the pathogen is able to actually stay in the air, persist in the air for much longer periods of time, and also is able to travel long distances. So basically breathing the same air that a person infected with this particular organism is breathing increases the chance of transmission. Okay? So in terms of these different modes of transmission, obviously airborne is an airborne transmission is the most worrisome because it is most easily transmitted. So in terms of infection control, trying to break the chain of transmission, we can break the chain of transmission by breaking any one of these steps, okay? By disconnecting any one of these steps from the next step, we can actually reduce transmission of disease. So we can destroy the reservoir, okay? So we can make sure that mosquitoes aren't breeding. We can make sure that we get good sewage treatment that reduces mosquito proliferation. It also reduces the likelihood of contamination, okay? So we can destroy the reservoir. We can also block the port of entry. So we can use things like masks and gloves and isolation of individuals who are sick and condom use to prevent the entry of the organism. We can also block transmission by using sterile technique, by using hand washing, by cooking food. Okay? We can also block port of entry. Again, masks, gloving, condom use, and we can reduce susceptibility of the victim, right? Good nutrition, good rest, and vaccinations, extremely important in reducing the susceptibility of the victim. Okay, so all infectious control measures in the hospital, out of the hospital, are really based on this idea of breaking the chain of transmission at optimally all of these steps. Okay, so in a hospital setting, basic infection control procedures are described as infection control precautions. And as you can see in this visual, the precautions really start off with the basic precautions that we call universal or standard precautions, and then they get more and more enhanced, okay? They get more and more enhanced depending on the particular disease and the pattern of transmission that the organism has for that disease. So standard precaution, but what's very important when in terms of understanding these precautions is that standard precautions are expected under all circumstances. So you notice that standard precautions is the first step. Okay? We can, no matter what else we're doing, we cannot ignore standard precautions. Everything builds on standard precautions. Okay? The next step is what we call contact precautions. And contact precautions are used when someone has a known disease that is transmissible through direct contact with bodily fluids. Okay? The next step is droplet precautions, where someone has a known disease that is transmissible through aerosolized droplets from things like sneezing and coughing. Okay? And then the most enhanced or the highest level of precaution is airborne precautions, where someone has a known disease that is transmissible through airborne transmission. Okay? So standard precautions prevail throughout, and then basically we're adding other layers to standard precautions depending on the microorganism and the pattern of transmission.